What exactly is cholesterol, or is everything bad, or there is something good also in this cholesterol?
Who had already a heart problem, blockage of arteries, that becomes a very important candidate.
Why do doctor prescribe lipid profile? Is it really needed? How does it work? Is it safe?
Because starting the medicine, as Dr. Amitabh rightly said, once I start the medicine, I need to continue for a long time. Once patient comes to us and we see the cholesterol report, it's not there that only one cholesterol report is going to make the total management. Side effects are there, which is sometimes a dose dependent also. They can have some muscle pain, or sometimes some liver enzymes can go up.
But what is one advice you will give to general people to prevent cholesterol issue, cholesterol related health issue in future?
The most important thing is the
Namaste everyone, welcome back to yet another episode of podcast. Today we are going to discuss about a very important topic, that is cholesterol. Cholesterol is something which almost millions of people are suffering from. What exactly is cholesterol? How do we interpret the cholesterol results? I'm very happy I'm joined by Dr. Pavan Shrivastava, who is a consultant physician practicing in Dubai since last 25 years. Welcome Dr. Pavan to today's podcast. Dr. Pavan, can you tell us something about yourself?
First of all, viewers, namaste, good morning. I am Dr. Pavan Shrivastava. I am studied in India and then trained in UK, worked in UK and Australia. And since last 25 years, I am working in Dubai as consultant internal medicine. Most of my patients, what I see is related to metabolic diseases, diabetes, and obviously the patients having high cholesterol and other metabolic problems.
Yeah, so let us start today's discussion, Dr. Pavan. Now, what exactly is cholesterol? How do you explain that for general person to understand? What exactly is cholesterol, and does it matter to us? Why does it matter to us, if at all? Yeah.
Yes, it's a good question. The thing is that the cholesterol is a fat, oil-like substance which is circulating in your blood, and every individual has got cholesterol requirement is there because it is required for all the cells of the body and for cell membrane for their work. It is required. It is also required for some production of some hormones like testosterone and estrogen, and also required for some digestive process in the body. The cholesterol is basically produced by two things in your body. One is exogenous, which we take the food, and because of that whatever food absorption happens, and then where it's converted into cholesterol. Another one is endogenous. Endogenous means body itself is also producing, and the production is happening in the liver. So these two are the source of production of cholesterol in the body.
Yeah, that was a very simple explanation related to cholesterol. Now, one common question which comes to everyone's mind is cholesterol everything? Then why do doctor prescribe lipid profile? So there is nothing like just a cholesterol test. It is called as a lipid profile. So is it same? Is it different, or anything else is there in lipid profile?
See, whenever any patient comes to us, we ask for lipid profile, and sometimes the patient themselves come and ask that I want to do a cholesterol test for me. So then we ask for lipid profile. So the thing is, lipid profile basically is, everybody should understand about this thing, because everybody is getting it done and then they're confused with the reports and all those things. So lipid profile consists of, first is the total cholesterol. Second, on the basis of their densities, they have been divided into high density lipoproteins, low density lipoproteins, very low density lipoproteins, and one more fraction is there which is triglycerides. So all these things makes the total cholesterol in our body. So when we do a lipid profile, the report comes in the form this: how much is your total cholesterol, how much is your LDL, how much is HDL, how much is triglyceride, and also some reports in the labs they give you some ratios also based on which is total cholesterol divided by LDL. One ratio is there, another ratio is there, total cholesterol divided by HDL. These are the ratios which are also helpful in interpreting the results and future planning of treatment, and also to check later on how much improvement is happening after the intervention.
Yeah, so viewers, please understand, cholesterol is just one component of lipid profile. There are many more components in lipid profile as doctor just mentioned. So that brings us to the next very important question. Often we read something like a bad cholesterol and
Yes.
good cholesterol. So Dr. Pawan, can you tell us what exactly is bad cholesterol, or is everything bad, or there is something good also in this cholesterol?
So yeah, so why people should understand this, that the body has got good cholesterol also, bad cholesterol also. So when we check the report, sometimes people go only with the total cholesterol. Let's say total cholesterol 240 or 230 and they get panic. No, you have to go to the fractions, because maybe your bad cholesterol is good but your good cholesterol is high. I have patients, those cholesterols are very high to the tune 90, 100 also. So genetically they have a good cholesterol also.
Yeah.
So the thing is that that's why we need to do the full lipid profile, in which LDL supposed is the most important thing as a bad cholesterol, which has been in over the years, studies has been done and all those things, and they have found that LDL is related with the process of atherosclerosis, which is causing the narrowing the arteries in the brain, heart and peripheral vessels. And also the triglyceride, which is also a bad cholesterol. Initially it was there that triglyceride is not related much and it is not required to be controlled, but now newer studies are there that we need to control even triglyceride and to keep in the normal limit, because if it's very high also, one thing is there, it can damage your pancreas also. And then comes the good cholesterol, which is HDL cholesterol. So HDL cholesterol is a good cholesterol. If you have a higher number of this thing, you should be happy that you have a good cholesterol which is protecting you from the process of atherosclerosis.
Yeah, so that was a very simple explanation, that there is something like a good cholesterol also in the blood. So we should try to keep as much or as high as good cholesterol and as low as bad cholesterol, for obvious reason. So now once we do a cholesterol report, is there anything like a diet or lifestyle, or is it just the medicine? So most important, I think the first thing which we should be knowing is what is the importance of diet and lifestyle in control of cholesterol.
See, obviously the diet and exercise very important impact on your cholesterol levels. So I will tell you first, once patient comes to us and we see the cholesterol report, it's not there that only one cholesterol report is going to make the total management.
Correct.
We have to have stratify the patient into, is he high risk patient, he is a low risk patient, or he has got a cardiac disease, and then we have to decide about the management. So there are the numbers, I will discuss later on, the number of cholesterol, how much we need to reduce, and over what time we can wait, all those things all depends on your coexisting conditions. If a patient is a diabetic, it is a different thing, management plan.
Correct.
Patient is a smoker or has got a family history of heart problem in early age, or he is already a cardiac patient. For those patients we have a different parameters, whatever is there, but the lower, whatever studies has been done, it is there, lower the cholesterol, one sentence, it is always better. So coming to the diet, obviously the diet is the cornerstone, and exercise, these two things are the most important thing in management of cholesterol, which we should be aware from the beginning, that if you keep your weight under control as per your height and age and all those things, and you have to do a regular exercise to control your cholesterol. Then comes the diet. Diet, obviously, with the diet which is containing more fat, more unsaturated fatty oils, another thing, and eating junk food or this thing, fried things, this we need to avoid from the beginning. So we have to develop a habit from the beginning for the food, which these are going to increase your cholesterol.
Yeah, so this is a very, very important one of the take home message from today, that not everything is medicine. Diet and lifestyle modification is like a cornerstone or important part of the treatment for the cholesterol related health issues. Now, what is LDL or bad cholesterol, and why is it so important? Like, I know it's labeled as bad cholesterol, so what bad does it do, and why is it important to reduce LDL cholesterol?
So the thing is that when the past the patients were getting blockage of arteries, of heart attack and all those things, so many studies were done, and the first study which was very important and is the basis of all this thing is Framingham study, which was done in 1970s and 1950s rather, and but then continued all these studies and all those things. So that has been established now. It is established fact now. The cholesterol LDL, if it is high, a person is prone for a formation of atherosclerotic plaque. Atherosclerotic plaque is whatever our arteries are there, they are tube-like structures, and if any deposition happens, that is atherosclerotic plaque. So if it gradually increases and it narrows your arteries, the circulation to the heart, to the brain and peripheral extremities can narrow down, and one stage will come, it will completely close. So this deposition is linked with high level of cholesterol. The other studies which were done, then they have found this thing, if we lower the cholesterol level, so the process of that becomes slower or sometimes is halted. Right. So very important is that we need to control the cholesterol to stop the process of making atherosclerotic plaque in the arteries of your body.
So it's a time tested LDL, that LDL is a bad cholesterol, proved almost like in 50s and 60s, and so lowering LDL is very, very crucial to prevent atherosclerosis. Now, we discussed about bad cholesterol, we discussed about diet and lifestyle modification. Now, the commonest medicines which we see for cholesterol related health issue is statins. The group is called as statins. So is it really needed? How does it work, and is it safe? Because see, most of the patients who are on statins for cholesterol, they have to take it probably for lifelong. So Dr. Pavan, in your extensive practice, is it safe to use, and how do they work actually, these medicines?
So see, the first starting when the patient comes to us and we see the lipid profile, so important, as I told you, first we need to see, is the patient diabetic? Number one, is the patient already had some cardiac event, heart attack or anything? Third thing is, is he having any family history, strong family history of heart problems, or is any other issues which are there which can be related with the further complications with the cholesterol. So once we have stratified the patients, and let's see the patient doesn't have much of things, but still the cholesterol is high, so we give some time to the patient, because starting the medicine, as Dr. Amitabh rightly said, once I start the medicine, I need to continue for a long time. So first is that we always give an opportunity for the patients to control the diet, control the cholesterol with the diet and exercise. Right. And everybody comes and asks me how long we can wait. How long I wait? I have told you, if you are not having any risk factors much, then we can wait for, let's say, 3 months, 6 months, and let's see, we can do your cholesterol follow up regularly and see how much improvement is coming. So first important step is that exercise, diet control, weight reduction, and if somebody is smoking, stop smoking. So if these things are taken care of, lot of patients get improvement and they are very happy with that, and then they continue to monitor their cholesterol and continue to have exercise and diet control. Coming to the medications, once we see that the patient is not able to, or you are not able to control your cholesterol with the diet, exercise and weight reduction, and you need to have medication, especially in patient with having previous heart problems or diabetic or smoker or having a strong family history, we need to start medication, which is statins. And statins has been extensively been researched, trials has been done, and it has been found that once we start statins, we get a very good reduction in your future complications or future getting any process of atherosclerosis. So many studies has been done, and it has been established. And now we have different statins are there. Most of the statins are all the statins are very safe.
Right.
Very few complications. Only few side effects are there, which is sometimes a dose dependent also, or some it is person to person. They can have some muscle pain, or sometimes some liver enzymes can go up.
Right.
So we keep a follow up of the patient, and if they continue to have some symptoms like muscle pain or cramps and all those things, we check for CPK, which is a muscle enzyme. Right. If it's really high, then we try to reduce the dose or change to another statin. Sometimes change in the statin also helps. Or if the liver function is getting deranged, we need to keep it monitoring. But overall, if you ask me, there are myths about statins that it causes sexual this thing, it causes fatigue, it causes other medical problems. Is not there. It is very safe medicine, and cases where we need to give statin is the first choice.
Yeah, so viewers, please understand that statins are safe to give, but there are certain side effects which Dr. Pavan just mentioned you should be watching for. So if someone is taking statins for long term, especially in high risk as he mentioned, so just watch for those symptoms, and maybe you should report to your physician at earliest in case if you develop something like muscle pain or some unusual symptoms, that you should visit your physician and get it identified. Now, apart from statins, I heard some injections are there, or some other medicines, or newer medicines or advanced medicines are there for control of cholesterol. Dr. Pavan, can you just tell us something about the newer treatment for cholesterol?
So,
yeah?
I will come to the newer treatment. We have now one injection, PCSK9 inhibitor, which is to be given within 4 weeks time and all those, but and another one, newer this thing also has come. So these medications, basically we have a group of patients where after full dose of statins also we are not able to achieve the target.
Correct.
So if somebody is not able to reach the target, we have to provide something else also. Or if you are not able to tolerate the medicine, if some liver enzyme is going up, or you have muscle cramps or CPK is going up, so we cannot give statins, but still we need to reduce the cholesterol levels. So in these cases, we need to go for this newer medication, and especially these medicines are there where they have a strong family history of which is called as familial hypocholesterolemia, where the cholesterol levels are really high, and they had previous attack of, let's say, of heart problem, and still we are not able to reach the targets in such cases. So it's a very small group of people are there where the statin fails or they are not able to tolerate. In those group of patients, we use these newer medications.
Yeah, so these are not the first drug of choice. So first is always diet and lifestyle changes, followed by statins, and if it is still not helping, or if it is giving you some sort of side effects, as sir mentioned, we can consider these newer treatment options. Now, coming to the practical approach, now how frequently someone should check cholesterol, and does it change if you have the frequency, does it change if you have, say, heart disease, diabetes disease, or kidney disease, something like that?
So as I told you before also, so first we need to identify the high risk patients. High risk patients are person who had already a heart problem, blockage of arteries. That becomes a very important candidate where we need to keep a watch on every 3 months at least for his cholesterol, which should be, as nowadays the recommendation is that it should be, LDL should be less than 70. Yeah. So the targets are different. Diabetic patients also one of the patients which are in high risk. So all diabetic patients keep checking their lipid profile regularly, as the other blood tests are done for kidney function and HbA1c and other thing. Along with that, cholesterol has to be checked and it has to be made under control. Third patients are those who have strong family history and or a smoker. So a big thing is there that smokers are more vulnerable and their cholesterol level are sometimes very high. So we need to keep a watch on their cholesterol levels. The frequency in these type of patients is more frequent. But if you don't have any risk factors, cholesterol is slightly high, and so you can do it at 6 monthly or yearly also. Correct. And see the effect. And one more question people ask, at what stage or what age I should start checking me? So there are so many things are there. It all again comes with this thing, how is your family history, correct, how is your weight, how is your diet, are you eating out most of the time, outside food, smoking. So in those patients, at the early age also, 30s also, patients are doing tests and we are finding very high cholesterol.
Correct.
So it's not there is any fixed age that you should start checking for your cholesterol. It's always there. It is better to check if you feel that I am not living a healthy life and I have got not doing regularly exercise, eating food outside, and not by smoking and all those things. They should do an early cholesterol check. And once you have done the cholesterol and no risk factor is there, and if you are doing some intensive program of diet, exercise, maybe after 3 months. But if you are regularly doing, maybe 6 months or 1 year time, you can do your cholesterol.
Yeah. So viewers, the frequency of cholesterol checkup is always individualized, and if higher the risk, whether it is a family history or if you have complications, maybe we will check it more frequently. So but everything is individualized, and that is usually decided by your treating physician. Coming to the treatment aspect, nowadays on social media we see lot of fancy diets, whether it is a keto diet, intermittent fasting, or many a times we do see some supplements which are known to clear cholesterol issue. So what, as a treating physician with such an extensive experience treating cholesterol patients, what is your take on all these diet? Are they actually useful for patient, or even if someone is following, what is your advice for these people?
See, whatever indicated is diet is there is low fat. Obviously low fat means you don't have to take red meat, less of oil, dairy product also fat free, and most important thing, whatever other diets are doing is, if you are able to reduce your weight, when weight is reduced also, it is helping to reduce the cholesterol.
Correct.
But if you go for keto diet where there is a lot of red meat and all these things you are taking, maybe your cholesterol and uric acid may go up.
Yeah.
So all the diets are not going to be good, but anyway, any other diet, intermittent fasting, yes, it will help, because you are going to, your body mass is going to reduce, your fat will going to reduce, so, and you will be able to do more exercise. All this thing going to help the reducing the cholesterol. Coming to the specific foods, like there are things that people say garlic is good, some dry fruits are good, and all those things. So as such, there is not a many studies which has confirmed that these are going to reduce much, but we have seen that they if you use some dry fruits, specifically this thing walnut and other this
Almonds,
thing
yeah.
almonds, so it can help you to reduce, but not to a big extent. So we cannot rely only on this, but including this, like chia seeds or oats and other things, they also help to some extent.
Flax
seeds,
yeah.
so they can be included in your diet, and they are not harmful also. So we don't need to go for any specific diet which is going only for this thing, or which can be harmful for your body, and not any other supplements as such has been documented. Only omega-3, that is fish oil, and which is fish oil capsules, and the 1000 milligram or higher doses are useful in reducing only triglycerides. So if somebody says that I am taking fish oil capsule and LDL is very high, it is not good. It is going to work only to reduce the triglycerides. So it has been proven. But if you have a high LDL cholesterol, the only thing which is going to work is statins.
Yeah. So this is also very important, another important take home message, that you cannot generalize these types of diets. So your need may be different from someone else who is actually benefited with that particular fancy diet. So before considering all these diets, it is better to consult your physician and take his advice whether this particular diet is going to be beneficial for you or not. So coming to the conclusion of this podcast, the one last question I would like to ask Dr. Pavan, what is the gist, or what is one or two important message you should be giving to the general people, not necessarily someone who has high cholesterol, but what is one advice you will give to general people to prevent cholesterol issue, cholesterol related health issue in future? Yeah.
See, if you see whatever the metabolic diseases, or we call it as a non-communicable disease, which is diabetes, hypertension, lipid, high cholesterol, making heart problems and all those things, the most important thing is the weight. So my most important message to all of you is that keep your weight under control, and especially waist circumference. All studies, all type of exercises. If you go to yoga, even if any yoga teacher or Baba Ramdev or anybody is there, they're having all the exercises, all the things are specifically for the reduction of waist size.
Yeah.
So you have to have control of, don't let it go up, because once the weight has gone up, you start getting waist circumference is increasing, you are encouraging things, bad things to come to your body. So most important thing is that after 30 years of age, the person starts working because of the nature of work, they are not doing exercises, eating outside, and they are gaining weight, and then suddenly they found that they have got high cholesterol, and that is the one reason why we get so young patients with the heart problem.
Correct.
Because of only one thing, that we have a sedentary lifestyle and we are gaining weight. The thing starts from there. So most important, keep doing whatever exercises you can do.
Correct.
There is no excuse that I don't have time, I am traveling too much, or I am busy or something.
Right.
You have to do regular exercise. You have to keep your weight under control. You have stop smoking, and have to have a healthy food, especially not to eat too much of outside junk food, avoid oily food, and balanced diet you can take. So if you start taking care from beginning, you are very much in safe situation.
Yeah, that was a very important message for all the viewers. So that brings us to the end of today's interesting and very, very helpful podcast. I would like to thank Dr. Pavan for
Thank you.
giving such valuable information related to cholesterol. So please understand, cholesterol is important for the body, but keeping it in a controlled level, balanced level is more important. Diet and lifestyle modification still will continue to be the cornerstone of any treatment. Even if you are taking medicine or you are not taking medicine, diet and lifestyle modification has to be continued. The treatment has to be individualized, so always consult your physician first before trying any new type of diet, especially for weight reduction or cholesterol. If you have any questions, if you have any suggestions, you can leave it in the comment. You can like, subscribe, and forward this video to someone who actually need to learn or follow the advice as Dr. Pavan has suggested related to cholesterol. Thank you very much.
Thank you, Dr. Amitabh. I'm grateful for Dr. Amitabh that he has given me an opportunity to speak about such an important topic, and I think you will get some insight about cholesterol and how to manage it, which will be helpful in your good, healthy future life. Thank you.
If you need any future topic from Dr. Pavan, please do write in comment.
Okay.
Thank you.
I am always available to give you advice. Thank you.
Thank you very much.